So diphtheria. You've probably heard the name, right? It sounds like something from an old book, a disease from a bygone era. But what if I told you this forgotten killer is not only real, but still a threat today? Well, in this explainer, we're going to pull back the curtain on exactly what it is, how it works, and why it absolutely still matters. All right, here's our game plan. First, we're going to dig into why this old disease is still making headlines. Then we'll get into the nitty-gritty of how it actually invades the body and unleashes its deadliest weapon. After that, we'll look at how modern medicine fights back. And finally, the most important part, we'll uncover the powerful shield we have to stop it completely. Okay, first up, the forgotten killer. Let's really understand why something that feels like it belongs in the history books is still a very present-day threat. To really get a grip on diphtheria's power, you have to look back. For generations, this wasn't just some bad sore throat. It was a primary killer of children. That dark history is so crucial for understanding the potential danger we're still dealing with. So at its core, diphtheria is a bacterial infection. You're looking at the culprit right here. But here's the kicker. Not all strains are created equal. The real, devastating danger comes from the ones that produce a powerful toxin. That toxin, well, it's basically a poison, and it changes everything. Now this slide, wow, this is what a massive public health victory looks like. Because of widespread vaccination, a disease that once terrified parents is now incredibly rare in places like the US. We're talking fewer than 5 cases a year. It is an incredible testament to the power of immunization. But, and this is a huge but, that success story isn't the whole picture. The bacteria is still very common in many parts of the world, as you can see. This makes it a serious risk for anyone who isn't vaccinated and travels. And it proves a really vital point. In our connected world, a disease anywhere can become a threat everywhere. So we know it's out there, but how does it actually work? Let's trace the path of this infection, from the moment it spreads to when those first symptoms start to show up. You know, the way it spreads is actually super simple and kind of scary because it's so familiar. It's just like the common cold or the flu. The bacteria travel in tiny airborne droplets when an infected person coughs or sneezes. Once you breathe them in, they set up shop on the mucous membranes of your mouth and throat and just start multiplying. And this is where diphtheria is really, really sneaky. The first symptoms, which show up within about 5 days, look like any old bug. You get a sore throat, a bit of a fever, you just feel kind of lousy. It is dangerously easy to just brush it off as nothing serious. But then, things take a turn. The disease starts to show its true colors with some really specific, really alarming signs. The lymph nodes in the neck can swell up dramatically, creating this look known as bull neck. And this is not just cosmetic. That swelling can physically squeeze the airway, making every single breath a desperate struggle. And if you thought bull neck sounded bad, this is diphtheria's most terrifying signature move. The bacteria create this thick, gray, leathery sheet in the back of the throat. It's called a pseudomembrane, and it's a mix of dead cells, bacteria, and other gunk that can literally grow to seal off the airway, leading to suffocation. It's horrifying. But the danger doesn't just stop in the throat. Not even close. For the most severe strains, this is just the beginning. That toxin we talked about gets into the bloodstream and starts to wreak havoc on the entire body. This is where diphtheria really earns its killer reputation. Think of this toxin as a systemic poison. It travels through your whole body just looking for things to destroy. It can inflame the heart muscle, leading to heart failure. It can hammer the kidneys, and it can attack the nervous system, causing paralysis that can affect your ability to swallow, move your limbs, and even breathe. And all that widespread damage leads to a pretty stark statistic. Even with all of our modern medicine, diphtheria is fatal in 5 to 10% of cases. Think about that for a second. That means for every 10 to 20 people who get it, 1 person could die. That is not a small number. So survival here isn't just random chance. It really boils down to a few critical factors. How quickly you get to a doctor, what your vaccination status is, and whether that toxin has already done serious damage to vital organs like your heart and kidneys. Time is everything. Okay, so faced with such a formidable opponent, how do doctors even begin to fight back? Let's break down the medical counterattack against an active diphtheria infection. The diagnosis really starts with a doctor playing detective. They're looking for those classic telltale signs. specifically that nasty sore throat combined with that distinct gray pseudomembrane. But to be 100% sure, they'll take a sample from the throat and send it to a lab to actually grow and identify the bacteria. Once that diagnosis is confirmed, boom, the response is immediate and it is aggressive. There's no time to waste. Patients are hospitalized, usually straight to the ICU. The very first move is to inject an antitoxin to neutralize any poison that's already circulating. At the same time, they start a 2-week course of strong antibiotics to kill the bacteria and stop them from making any more toxin. And through all this, the patient is kept in isolation so it can't spread. We've seen how dangerous this disease is and how intense the treatment has to be. But now we get to the most important part of this whole story: how we can stop this entire terrible chain of events from ever even starting. You see, the best way to win this fight is to never have to fight it in the first place. We have an incredibly powerful shield, and it is this: vaccination. It is, without a doubt, the single most effective tool we have. It is the cornerstone of diphtheria prevention. Now, get this, because it's a really weird and super critical fact about this disease. Unlike a lot of illnesses, actually getting diphtheria and surviving it does not make you immune. You can absolutely get it again. This makes vaccination even more essential because it gives you protection that is far more reliable than the infection ever could. And that protection, it's not a one-and-done kind of deal. It's more like a subscription you have to renew. It starts with the DTaP vaccine series when you're a kid, but that immunity fades over time. That's exactly why adult booster shots are so critical for maintaining not just your own protection, but protection for the whole community. And all of this brings us to one final, really big question. If we have the tools to completely prevent diphtheria, why is it still a threat in some parts of the world? Its survival isn't just a story about a stubborn bacteria. It's a story about our interconnected world and our collective responsibility to make sure that life-saving tools like vaccines get to everyone, everywhere. Wow, okay, we covered a lot of ground today. If you found this breakdown of diphtheria valuable, just imagine what else we can learn together. Here at MediByte, our whole goal is to make these complex medical topics clear and easy to understand. To help us keep doing that, please take a second to like, share, and subscribe. Thanks so much for watching.